Everybody, how are you all doing? I hope you're all doing well and thriving and making the best of every opportunity that is presented to you. I just want to stop by really quickly to talk about something that has been on my mind for a few weeks, and I've been putting it off, but it's late evening. I've had a long day at work, and I was about to settle down to kind of do some finishing touches on my documentation, and decided to make myself a warm cup of tea. And the subject again popped on my mind, and I thought, hey, let me get it over with. And then it's not something I think we do have the time right now, or I am the best person to talk in details about it. So I just wanted to put out a few points for whatever is worth. And we will at some point talk about it in great details, hopefully with people that have a wealth of knowledge on the subject. So especially when it comes to diabetes management and cancer management, there has really been a lot of talk about complementary and alternative medicine lately. And I noticed that most of the people that talked about it on Facebook and other social media outlets have been using the terms complementary and alternative medicine interchangeably. But those are very different terms. They mean different things. So, complementary medicine is actually things that are done or products that are used in addition to standard treatments. So, they are used in addition to the medications or the other treatments that conventional medicine is using in treating those disease conditions. On the other hand, you have alternative medicine, which is used instead of, it is used in place of standard or conventional medicine. Examples are teas, for example, vitamins, so teas, vitamins, traditional healing practices, spiritual healing practices. Some people use these in addition to their standard treatments that they are getting from conventional medical practitioners. On the other hand, you have people that will use teas, vitamins, herbal supplements, nutritional treatments, spiritual healings, traditional healings. They will use them instead of conventional medicine. So that is the difference. Complementary, you're using it in addition to. They are complementing, they are complementing conventional treatments. On the other hand, alternative medicine is using instead of conventional medicines. I hope that is clear. What I want to say here is the decision to use complementary medicine or not to use complementary medicine, to use alternative medicine or not to use alternative medicine is very person specific. It is an individual decision. It should not be something that is pushed on you to either use complementary or alternative medicine. And whatever the case, if before you decide on whether or not to use complementary and alternative medicine, you should be well informed about the different options at your disposal, what their side effects are, what their potential side effects are. Like any conventional medicine, these things do have side effects, and you should really be wary of anybody that tells you, oh, this product is side effect free, this product, it has no side effects, and it will it cures everything, and it cures anything and everything. You should be really wary of those and ask questions. So in connection to complementary and alternative medicine, we should be addressing the issue of goals of care. You know, there are people who choose to manage their symptoms and not actually treat the disease because they understand that undergoing aggressive treatment for certain diseases could be very stressful, and so they decide to only manage the symptoms of the disease. In that way, whatever time they have left with the disease untreated, they want to focus on the quality of life they have. So they would use things to manage the symptoms, to manage, for example, if there is pain, they want to be pain free. If they feel like they want to vomit all the time, they want to be able to eat and enjoy their meals without having that sensation of vomiting. So they want things that would help them to manage the symptom of feeling to vomit all the time. If they have diarrhea, they want things to manage the diarrhea. They are managing the symptoms of the disease, but not the actual disease. In that way, they can live their lives under good symptom control and really enjoy whatever time they have. On the other hand, you have people who will go to any length to make sure that whatever the treatment is, they will undergo that treatment to attempt a cure to whatever disease they are suffering from. Those are two very different approaches. While some other person would only go for treatments to manage their symptoms, the other person is going aggressive to buy as much time as possible, which could mean that they will be uncomfortable. Sometimes they might be in pain, but their satisfaction is being alive and breathing. So the one thing that we should be mindful of is, if we decide, or if an individual decides to use alternative or complementary medicine, to be very specific, especially when it comes to nutritional supplements and herbal supplements and our roots and vitamins and all that fun stuff, we need to consider the side effect, or not even the side effects per se, their ability to interact with other medications you might be taking. Some people might say, oh, it's natural, so you can take as much of it as you want, or you can take it with whatever you want and you are fine. That is not true. The supplements do have the potential to interact with other medications you are taking. So you should be mindful. I'll give you a very simple example, something as simple as ginger. We have people that have bleeding disorders, people that their blood does not clot easily, so they really do bleed easily. Just making yourself ginger tea increases that risk for you to bleed more. And there are certain medications, especially people who are taking medications for anticoagulation, that is medications to make their blood not to clot, so they don't form lumps in their blood easily. And if you are on such medications, especially there is a common medication, Coumadin or warfarin it's called, it does interact with simple things like that. So you want to be careful. You want to be sure that when you go to the person that is prescribing those medications, you let them know that you are also taking herbal supplements, you're also taking nutritional supplements, so they're able to cross-check the interactions and advise you on how to proceed. I think in this day and age, our conventional medical practitioners are well informed enough that and open-minded for the most part to look up the potential interactions between whatever you're taking and your conventional medicines. Even the conventional medicines, you cannot just buy anything from over the counter. Please find out that information. Let your prescriber know everything you are taking so they can better advise you. Because if you continue taking what you're taking without consulting with somebody that knows a thing or two about those medications, you are potentially putting yourselves in harm's way. We need to take medications responsibly. It doesn't matter if you're going for conventional medicine, or you're going for complementary medicine, or you're going for alternative medicine. The pearl is be informed. Healthcare providers, my ask is to keep an open mind and be non-judgmental. There is a big push on cultural sensitivity these days, which I totally support. So you might not understand the treatment options or the treatment choices of other people. It makes sense from them culturally, for them culturally. So if you are a healthcare provider, the ask is for you to be open-minded, learn about those options so that you are able to better advise your patients on the advantages and the disadvantages of the treatment options they present to you, so they can make better informed decisions. Again, if you want to go for complementary or alternative medicines, entirely up to you, but be careful and beware of all the advertisers that say, oh, just boil this, and they don't have any measurement quantities, they don't take into consideration what other medications or what other treatments you might be taking. Take that with a grain of salt. Do your research. Be safe. Taking care of yourself or your loved ones should be on high priority, on your list of priorities, right up there. So whatever it is, whatever your treatment choices or decisions are, my only ask is be open and make your decisions based on factual information. Take care of yourself out there. And for those of you in Cameroon, Nigeria, or around there, be careful of the fake cough and cold medicine that is killing children. Take care, everybody. See you in a little while. Bye-bye.